Hi, my name is Steele. I'm here to talk about the role of mental health care practitioners in South Africa, and I'll be talking about this in the context of the pandemic. Obviously, as we all know, the impact of the pandemic, of the coronavirus, of the shutdown on mental health in this country has been quite large. I think it's important for us to acknowledge the socio-historical context that this country comes from and some of the trauma that's already present within the population. And this is acting only to further traumatize an already traumatized country, an already traumatized population. I think it's important for us to understand the impact of this pandemic on people with underlying conditions, and as we've seen, this just exacerbates anything that's already present, whether it be anxiety, whether it be depression, whether it be trauma. What we've seen is an increase in domestic violence in times like this, an increase in suicide rates. We've seen an increased need for mental health care in this time, and this seems to be in a time of reduced access to mental health care. And it's really important for us to understand the impact that this is having, and then also our role as mental health care practitioners within the country and how we can make an impact in this. I think it's also important for us to separate the impact of the pandemic itself from the impact of the shutdown itself, because I think what's happened within the pandemic has been an increase in fears and anxieties around contracting the virus, for example, an increase in cleaning behaviors, all of us hand sanitizing all the time, needing to walk into a space and we've all got a mask on. You know, there's been an increased fear from interacting with other people, whether it just be we're needing to distance yourself with social distancing. We've needed to learn this whole new language around the pandemic and around our ways to behave around this time. I think it's also important to understand the impact of the lockdown and the quarantine that's occurred from there. There's been the differential impact that's happened. There's subsequently some people have been locked in while other people have been locked out, whether it be families that are all stuck together now, not being able to get any kind of distance from each other, and maybe some tension that builds up as a result of that, versus someone who's now locked into their place and isolated alone and not being able to access their friends and family and their social support networks that are really important for them. I think it's also important for us to acknowledge the fact that the pandemic and the shutdown has changed the life in the country right now, whether it be kids now being forced to stay at home with their parents not being able to go into work, and how that might have exacerbated some of the underlying conditions that are there, but it also might have lessened some of the problems that are there, whether if there was increased stress and tension at work and now no longer going into work and being able to get a small sense of relief from that. Also needing to understand the economic crisis that might have an impact on the financial impact that's going to have on families and within the country at large. As we know already, the lockdown has had quite an economic impact on and driven somewhat of an economic crisis in the country. And I think it's also important to understand that mental health by itself and mental health problems by themselves have an impact on the economy. So whether it be an increase in depression seems to drive a dip in the economy, and we'll see that there's a dual impact from both the shutdown and also the corona and also the pandemic. I think it's important for us also to differentiate the impact on class and socioeconomic status within the country, as some people have increased access or better access to these kind of services where they can gain help from, better access to be able to receive the help that they need, where some people do not have that same access. We've also seen in these times, just with regards to food, and how hunger is then driving a lot of different crimes within the country as well. And it's important to understand that this is all part of the impact not only of the pandemic but also of the shutdown. I think it's important for us as mental health care practitioners to step forward in this time and not to step back. You know, as I say that, stepping forward in this time, we also need to acknowledge that we are part of the pandemic, and that it's okay for other people to reach out, but it's also okay for us to reach out ourselves. It takes an awareness of what's going on in the country, an awareness of the different impacts that this is having on the country itself, but also on ourselves and on our colleagues. It takes courage for us to step forward and reach out and provide the help that other people are needing. But we also need to make sure that we're addressing the self-care that we have and our own issues there, so we can help people in the best way possible. I think also an important role for mental health care practitioners in the country at this time is to be an advocate for mental health and mental health care. And I think moving into October, which is our Mental Health Care Awareness Month, it's important for us to step forward into this time and really to step forward with intentionality and with mindfulness. I think it's important for us to acknowledge that we are also part of this pandemic and that it's okay to reach out. It's okay for you not to be okay. And I think that when you're needing these services, for you to source them in your community, to look at places like Lifeline, to look at places like your local clinics, to look at places like the South African Depression and Anxiety Group, and also then to reach out towards family and to reach out towards friends. And once again, while you're reaching out, it's also important to acknowledge that you can also help your friends and family in this time. Thank you very much for watching.